Hey guys, A Simple Aesthetic, the podcast where we talk about everything beauty and anti-aging. This episode, I'm your host, Dr. Abraham, and I'm here with Lindsey.
Hello, I'm Lindsey. I'm a physician assistant.
Welcome back. We've had Lindsey a few times on this show, and everybody loves having you. So thanks again for coming. And today we're talking about pigments, discoloration in the skin. So we're going to talk about what causes it, what can we do about it, and what some treatment options are, whether the lasers or creams or other stuff. So ready?
Ready?
Let's dive in. So can you tell us just a little bit more, like a basic introduction about like pigmentations? Why should people listen? What causes like pigment changes in the skin and that kind of stuff?
It's rare that I don't have a patient that has some type of pigmentation concern. It just varies based on their skin type, their genetics, whether they're ginger or other ethnicities that tend to form pigment in different layers of the skin. So we basically treat per their skin type.
Gotcha. And so, like, one of the main things that can cause pigmentation or skin, you know, color changes in the skin, spot in the skin, is going to be, sun damage combined with aging. There are obviously other things that can cause it, but I would say, like, probably the two, the biggest factors are going to be, sun damage. Probably one of the biggest factors that we can do something about is sun damage,
Yes.
because at least we can protect our skin.
Yes. The intrinsic factors a lot of times are hormones, menopause, pregnancy, inflammatory processes, and then heat a lot of times along with sun damage.
Gotcha. So, and just kind of like the different types of pigmentation, and there's a lot, so we're not going to go through like everything, but there's sometimes people we'll talk about lentigines, which sometimes people will talk about like sunspots or A-spots, as liver spots. And then there are things like melasma, which tends to be more hormonal.
Yes.
Sometimes like with pregnancy, it tends to happen. And that would be like more diffuse sometimes than as opposed to like specific spots. And those are just like two of the main categories of pigmentation.
Yep. Yes, I see a wide range, and pigment can live in different depths. So freckles, lentigines, sometimes sunspots can live very superficially on the epidermis. Those can be fairly easy to treat with IPL laser or various other lasers, chemical peels. You can brighten and lift superficial pigment fairly easily. Deeper pigment is a little more of a process, but no matter what the type of pigment, always it's a lifelong journey. And always I combine it with a topical agent that they use at home.
And that's why, because somebody might be listening to this and like they don't care if it's like deep or superficial. It just looks like a dark spot, but we care because it's gonna change the way we treat it. Like if it might look similar to somebody, but if it's a superficial, if you feel like the pigment is more superficial, we're gonna choose a different type of treatment than if it's a deeper, pigment, as you mentioned. And you've kind of mentioned already like some of the lasers that can be done. So you've mentioned an IPL. Talk a little bit more about IPL. I know it stands for intense pulse light.
Yep, it's an intense pulse light. It's not actually a laser, but it's a light beam that just so happens to be able to break the bonds between melanocytes. So it basically injures the melanin cells in the body. They become dead cells. They turn dark and slough off the skin. And then you can form new ones over time, but often when people start doing these treatments, they tend to be more diligent about sun protection, and they don't always reform the spots over time, or as many.
For sure. And sun protection is, because that's why we kind of started by saying that sun damage can cause a lot of these spots. Now, unfortunately, a lot of times, like the sun damage accumulates over time, so we might not even if you're protecting yourself, like you still get some of these spots from all the like damage that you've had years ago.
Yes.
but as you kind of like mentioned, you still want to protect yourself because if there's been some damage, at least you want to protect it from now on so that it doesn't, you don't accumulate more and more damage to the skin for sure.
And even though IPL isn't used technically as like a cancer treatment, it can really basically treat precancerous cells and inhibit sometimes certain cells from turning into cancer, because those dark spots will absorb light very strongly. And if you get rid of that dark spot, it doesn't absorb so much radiation and light over time.
And so when it comes to pigmentation changes, I know you mentioned that like there's different skin types, and sometimes there's something like hypopigmentation where it's like the spot is lighter than the surrounding skin, and then hyperpigmentation, which I think would be probably more common, especially when it comes to like sun damage and that kind of treatment. The spot is darker than the skin. Now, the IPL, I know you mentioned it. Is that like the only thing that can be used for brown spots, or?
That's not the only thing. IPL typically targets very superficial pigment. So you're limited as to what type of pigment you treat with that specific laser, but it works very well for superficial. It also works well for vascular pigment. However, we have V-beam, which is a very direct type of treatment for reds to purples and some browns, and is ideal for rosacea or just redness, broken capillaries, hemangiomas, any vascular type of pigment. And both have very little to no downtime.
Awesome. And I know one of the other things you always talk about is the skin type, because like that will also limit like which treatments you can use. Certain ethnicities will respond better to certain lasers, and certain skin types might not be as much of a candidate for a certain laser kind of thing.
Mm-hmm. Yeah, Pico laser is a great option for all skin types. I love that laser, especially for darker or melasma prone, because it's not using heat so much on the skin. It's very gentle, and it's an actual laser that can target deeper in the epidermis or dermis to kind of break up that pigment.
And I know you mentioned just a few minutes ago how heat can be one of the things that can cause pigment. So it's part of the reason I think why sometimes like certain lasers that produce a lot of heat might be an issue when treating self-pigments.
Yep, you can actually cause hyperpigmentation on prone skin types if you use lasers that are really injuring or heating the surface of the skin.
So what about like if you, other than laser, if complete other treatments? You've mentioned, I think chemical peels was one thing.
Yes, chemical peels are a great option for all skin types.
Yeah.
You will turn over multiple dead layers of skin in addition to breaking up pigment or turning over superficial pigment. But with that, you do have a little more sensitivity and downtime. If it were my way, I would always start somebody on a chemical peel first.
Gotcha.
And basically turn over the dead cells. It's really 3 to 5 days of moderate to mild peeling or flaking, and some sensitivity. You don't just want to be like sunbathing during that time. But otherwise, just a few days of downtime with a chemical peel, and then you're kind of left with this blank slate to work with, and the lasers penetrate the skin so much better when you don't have dead debris in the way.
That makes a lot of sense. And I know with the chemical peel, you can also control the strength of the peel, which will kind of control the downtime. So trying to find that kind of perfect balance where it's not crazy downtime, but it is enough to kind of for the peel to do what we need it to do.
You can get right under the eyes. You can get around thin areas. Yes, you can target anywhere you want with the chemical peel.
So we got lasers. You mentioned different lasers, chemical peels, creams. Do creams sometimes help?
Yes, always. And they've come a long way. For a long time, there were more bleaching creams available. However, you can't use those for too long. There are some adverse events that can happen, sensitivity or pigmentation problems with hydroquinone or other bleaching creams. We still use those in certain circumstances, but now a great option are products that have tranexamic acid in them, and those you can use long term or indefinitely. And that down regulates your melanocyte production so that when you are exposed to heat, sun, injury, inflammation, hormones, you're not readily firing those pigment cells, and so you can control it much better.
Honestly, this stuff is so interesting. It's crazy how many different options there are, but yeah. That's why kind of with these kind of treatments, again, and I know we always say that, but you do want to talk to a professional because there are a lot of options, and most of these options that you've mentioned aren't things that somebody's going to be able to do at home by themselves, right?
Right.
So you want to make sure you talk to somebody because there are some great treatments out there, and it can really help clear out the skin and get rid of some of that damage. You still want to do your part at home, like in terms of like the sunscreen, and all that stuff to protect further damage. But having access to all these like lasers and all that treatment is really cool.
Yes, it's so great. And yeah, you usually have to go to a medical spa, a dermatologist's office to get these products, but they're very, very safe. They're usually just dispensed on the spot. We have Even Incorrect by Skin Medica and some other brands too that work so well and are tolerated great.
Gotcha. Perfect. Yeah, I know these are some of the most common ones: the IPL, the Pico, and as you mentioned, the skin type will play a big role. Even with the peels, even though there's peels that can be used on every skin type, sometimes you might choose a different peel depending on each skin. Are there any other like treatments that you think are pretty popular for this?
Yeah, with any of the options that you just listed and that we talked about, typically it's a process where you come in for a series of treatments, sometimes 5 treatments over the course of a year, sometimes 3, depending on how severe the pigment is. There is another option that's a little more aggressive, CO2 laser. That's been around since the 1960s, but has improved in its technology so much over the last 10 years about. And with that, you can target deep and superficial pigment for a proper candidate. And you can essentially treat pigment a little more aggressively so that you're not bound to so many treatments at once over the course of a year.
And I know we're gonna have, we'll have a whole episode just about the CO2 laser soon because it is a pretty powerful laser, but kind of like related, but a little bit different. I know you mentioned the Pico. I know this can also be used for tattoo removal, which I guess in a sense is like a pigment in a way, but IPL is not typically used for the tattoo removal, but a Pico laser, we use it for removing tattoo, even colored tattoos, all the time. So
yes, resurfix you can use for deeper pigment too as well. But yes, we do a lot of tattoo removal with Pico.
Awesome. Perfect. Well, thank you guys for joining. Thanks again for being with us today, Lindsey. And we'll see you guys next week. Make sure you like, share, and comment. Let us know what other topics you want us to talk about. And see you soon.